just kind of hugging the roof of the mouth, stay parallel with the roof of the mouth, straight on back in there to get the nasopharynx. And typically what I would recommend you do is check and see which side of the nose is more open first. Have them breathe through the nose. Is the right side more open or left side more open? Some people will have a septal deviation or maybe a larger turbinate on one side or possibly a polyp. So you want to pick the side they can breathe the best through to start out. Go straight on back in there. And then maybe about 5 to 6 centimeters back into the nose before you hit the nasopharynx with that tip. So you're going to be thinking, man, this thing is pretty darn far in there. I wonder if I'm too far or not. You can kind of mark it with your finger. Maybe if you have a little ruler, you can kind of see about where 5 or 6 centimeters is and kind of get a gauge whether you're in there far enough. But once you get it back there, you should feel a little resistance as that hits on there. You're going to say, that's not passing so easy anymore, and it looks like I'm about at that 5 or 6 centimeter mark. Is probably there. Once you get touching that, you just want to twirl that swab around a little bit, try to get some of that mucus and viral particle on there if it is present, and then just slide back out. You don't have to leave it in there for 30 seconds or a minute or anything like that. Just a couple of twirls with that swab, gently of course, and then slide back out. I think the instructions that I've seen are all talking about doing a swab on both sides of the nose, go one side then go the other. So I would say the harder side for second. If it is a bad deviation, you just can't get down there, you might just abort that second side. If you've got a good swab on the first, to avoid injury to the nose, maybe just do that one side. It's all swab in the same place. The nasopharynx is the same on both sides. It's not like one side is different than the other. It's the same thing. So, what else? You might get a little blood tinged mucus from the nose after putting the swab in, even if things are going great. If that happens, that should be very limited, self-limited, probably won't require anything. If there's a little heavier oozing or bleeding, you could try a little Afrin spray, maybe just a vasoconstrict and get that bleeding to settle down. So you might mention that to patients. Some of y'all are testing pregnant patients. You might check with their OB-GYN doctor before you tell them to use Afrin spray in that case. Make sure it's not going to cause any issues with contractions or anything that way. What else? Do you guys have questions? Anything I can answer for y'all? They did mention on the video that I sent out to Wendy yesterday that you can do a transoral swab as well. So if you look at the nasopharynx, this area we're trying to get the swab on, you can see it extends inferiorly to the back of the oral pharynx also. So you can imagine going transorally, you could get back there. You just have this kind of landmine of other structures you don't want to touch with that swab getting back. So if you touch against the teeth or the gums or the tongue, the lips, there might be other bacteria or viruses on that might make it hard to get a good sample. So you just want to be ever so careful not to touch anything else, getting that swab back there to the back of the throat, using a tongue blade and a light and so on. Then when you're back there, try to swab maybe upward toward that inferior aspect of that nasopharynx and try to get some of that mucus there onto the swab if you can. So maybe that would be something on a kid more than an adult. Most adults I think should be able to tolerate it. It shouldn't be that bad. It's not fun, but it's just momentary. It shouldn't be too bad. Should be able to tolerate it.
So do you do it on both sides? Or
on the nose? That's what they're recommending. So I guess if you can pass the easily on both sides, go ahead and do that. Maybe a better chance getting more sample if you do it on both sides. If you can't get it in, like I've seen some patients where the septum is so far over, there's no way you can get anything in there. And you might run into one of those patients and not be able to see in their nose and tell that, and you just can't get this thing to go past, If that's the case, I wouldn't torture the patient too long as you felt like you had a good swab, at least on the one side.
Oh. Yeah. And for pediatric patients, is it going to be the same length?
Probably not, maybe smaller, shorter distance. Their heads are a little smaller, so, you're probably going to have maybe take a centimeter or two off on that. They may also have bigger adenoids that might stick out a little further anteriorly, which might shorten that distance for you a little bit too, especially if they're coming in for tonsils and adenoids, if that's the reason they're coming. So, good question. Anything else I can answer for you guys? And the other thing I was mentioning downstairs, and I forgot to tell the last group, but you kind of want to hold it like you're holding a pencil. That's how you have the finest control with your fingers. If you're holding it like this, you're really using your forearm muscles and all that to be your fine motor control, and it's going to be a little harder to be precise. So I would hold it like you would hold a pencil and just kind of advance it that way in there, trying to have better control with the finer control muscles that we use. Okay. That's all I got. Unless you guys have questions, I'm happy to answer anything that you might want to know. Or
thank you for
you're welcome.
Thank you very much.
Yeah, we're just right across the parking lot. If y'all think of a question, have one, just let me know. At the office every day, waiting